Hey guys, welcome back. This is Dr. Kevin. Today's topic of conversation is hip pain. It is massively prevalent in our society, more now than really ever before. Why would it be now more hip and knee pain than ever before? What has changed in the last 20 years that we're doing now more than ever before? Sitting, obviously sitting. We're sitting all the time. What does that do? That changes your hip bones? No, it doesn't change your hip bones. It shortens the musculature of the hip. Primary muscle involvement is called the psoas. No, I didn't say sore ass. I said psoas. P-S-O-A-S, psoas. It's a muscle that raises and lowers a leg. It pulls the hip into the socket much tighter than it's supposed to. There's supposed to be a nice gap in that tissue to allow the movement of this bone, ball and socket complex. Psoas and inflammation, top two causes of hip and knee pain. How do we deal with that at the Bellevue Pain Institute? Well, I talked to you about it before, I'll talk to you about it again. It talks about breathing, we talk about water, we talk about the laser's healing ability to massively increase circulation, and then we're going to talk about muscular rehabilitation. It's not about doing a bunch of crunches and sit-ups and doing that. It's about properly assessing the abnormalities, right versus left, front versus back in your body, your unique body. What has sitting done to you in relationship to all the previous small and large injuries you've been through in your life? That's where the experts come into place. That's us. We're going to go through and evaluate properly what has been the cause of your hip pain, what stage of degeneration those hips are in. Perhaps it's too far gone. Perhaps you actually are one of those people that now have to go for hip replacement surgery. Remember, even in today's age, those hip replacements, you got 10, 15 years out of them, and then you may have to have another one, and 2 in a lifetime max, and $70,000 to $100,000 each surgery. So how about let's look at some conservative aspects, conservative treatment approaches first. Obviously, any surgeon worth his salt is going to tell you, try everything else first. If it doesn't work, then try surgery. That's where we come in. Bellevue Pain Institute, we're specialists at resolving hip and knee pain because of the rehabilitation approaches and the way that we deal with the inflammation and psoas or short muscle contractures. Hey, got a tip for you. Deep lunge. You want to lengthen the psoas muscle simply with the support of a table or couch, and as long as you're not moving into pain, I'll have you take a deep lunge down, stretching the one that's in the back, deep lunge down almost to where knee touches the ground, and then take the back hip and rotate it away from that back leg. If you can get that away from that back leg, you'll stretch that psoas. It's a very healthy and safe stretch to do. Whenever you're stretching a muscle, hold for at least 30 seconds. Breathe deeply as you stretch. Dr. Kevin signing off. Live large at any age.